Okay, and so this is the Board of Health meeting of December 4th, I guess, and the entire Board of Health is here, and also our public health nurse, Sarah Fisk. And be quiet. Just quickly, can we approve the minutes from last time?
I move to approve the minutes.
Second.
Everybody in favor? Is there anybody not in favor? I mean, this is just the minutes, geez. Okay, so let's say that the minutes are good. Before we get to Sarah, and I don't want to keep Sarah hanging on here to, I'm sure she has other things to do. I just want to talk briefly about the MAFCO meeting next Monday or Tuesday, whenever it is. What's the story with that? I mean, is that something that we all have to go to? Is it in person? Is it somebody? There's apparently some kind of training involved in it.
Yeah, so it's virtual. We don't all have to go to it. So I tend to go to the meetings on our behalf, and I'm the co-chair.
With that, you kind of have to go.
Yeah, so I have to go. With that said, there is a DPH representative will be there to do a training on WebEOC. So if anyone wants some additional training on how to use it, I'm familiar with it. Kat, I know you go in and respond to the drills. But if others on the board want to get some additional familiarity with it, the only catch is that we have to have the login. So if you're going to attend the training, you need to be able to use our shared login. So if you need a refresher, Arlene recently updated our password. So if you need a refresher on the login and the password, I can get it to you if you want to attend.
I have the idea that Arlene texted that login to us.
It's in a text message to all of us.
Okay.
Yep.
Okay.
And if anyone needs it sent again, I can do that. Yeah, I'm looking it up right now. Yes, I have it saved.
Okay.
In my password manager. And I can convey that to anyone who might need it.
Okay.
And so outside of the training component, it's largely an informational meeting. And I, of course, would bring the information back to the board. Okay.
My problem with the logging into WebEOC is that it's on my computer and it remembers it all, but it doesn't tell me what it is. So it knows and I don't. So if I had to do it from some other place, I would be not a good thing. So you'll go to that on our behalf, and if anybody else wants to join you, it's at like 5 o'clock on, is it Monday?
It's Tuesday the 10th, 5 o'clock.
Okay.
And it is virtual?
Virtual, yep.
And will we all get the link? Like if I were to decide that, oh, I'd kind of like to do that, will I have the link?
Let me see how it was sent.
Because I have it on my calendar. Let me see if I saved a link I often do save a link onto the notes in my calendar. Let's see.
It's unclear to me the way it was sent, if it went to each individual Board of Health member, or it definitely went directly to me, and it might have gone to
I don't have a link. In my note on my calendar, I just said TBD, who is representing us. So
I'll circulate the link to everyone.
Okay.
so that you have it. And, again, if you wanted to join so you can benefit from the training.
Mhm.
But then also if you don't have the password for WebEOC, you should let Arlene or me know.
Okay.
And then the only other thing related to math code that I would throw in there, and it's WebEOC related, is has anyone's contact information changed recently? Your email or cell phone number? Because I can go in and update the 24/7 contacts for us.
No, mine hasn't changed.
All right, great. I'll do that too.
Great. All right. Sarah's going to tell us a bit about what they're doing with their opioid settlement money in Leverett. But there's another thing that I would like to quickly bring up so I don't forget. And that is somebody sent us an email today who's on the board at the Shutesbury Athletic Club and said that there's been interest at the club in having a CPR class as a community event. And so they reached out to what he said was an EMT club at UMass or in Amherst or something down there. And they said they could do it, but they would charge $65 per person, which seems pretty exorbitant.
Yeah.
And so this guy is also on the volunteer fire department. And Lenny gave him some ideas to look for funding or alternative teaching, and also reached out to us. So if anybody has some ideas here, especially maybe Sarah, who might know something, let me know what they are.
Do you know that gentleman's name?
Isaac Goldstein.
Do you know who his the person that he was speaking to at UMass was, the EMT?
No,
No.
I don't.
So part of our initiative is to get the public health nurses that are interested in trained to teach the public general CPR. It's a little bit tricky because we're not affiliated with a hospital. So it's a different kind of training. There is a fee. I don't think that it's $65 because if we're trained, then you basically don't pay the trainer. You pay the for the book and for some of those fees. But I want to say I don't think that they're quite that expensive. I know that we are actively looking into it and have a contact at UMass. And during break, supposedly, we're supposed to have that opportunity to become trainers, because it's different than just getting certified, because you can get certified through a trainer, but if you want to train the community, that's a different kind of certification. So we're looking into that. I don't have anything more than that to give, just that it is in the queue, and we have been working on this since the summer. And it is a goal of ours to actually become trained so that we can offer community CPR classes.
When you say we and
the-
ours, who are you referring to?
Say it again.
You say it's a goal of ours. Who is the our?
Me, Megan, Anne from Sunderland Board of Health, and then the fire chief in Leverett. We've been talking about that since probably August, or maybe even before that, because that was one of his goals. And I said that we were actively looking into that. So
well, great. I'll pass that information on, and they'll just have to be patient.
yeah, and I've actually had inquiries about this. This is definitely something that the community is interested in. And I have said that as soon as I become certified to teach the public, we would start offering classes like we do with other education, and, enough so that people could be certified. And there's also first aid courses that we can offer with that certifications, and some other kind of, fundamental safety courses. So it's a good thing to have. And I think that people will be interested in it.
I think you're right.
So I'll keep you posted.
Okay, great.
That was gonna be my question, though. Does this fellow Isaac, has he done any pre-qualification? I mean, how much interest is there?
Look, I've received one email from the guy, and I'll read it to you if you'll hang on. What's his name? Isaac. He says, "My name is Isaac Goldstein. I am a board member of the Shutesbury Athletic Club, also on the volunteer fire department here in town. Blah, blah, blah. During the past couple of board meetings for the athletic club, there has been a growing interest for a CPR class. I have done some outreach to find an instructor to come to the athletic club to run a CPR class as a community event. The EMT club at UMass would be able to, but quoted a cost of $65 per person for the event. I spoke with Chief Zerwanka from the fire department, and he mentioned the organization Community 911, and I have reached
They
out to
don't
them
offer trainings.
to inquire as well. I was wondering if the town could provide any kind of support, either logistical or financial help, or financial to help support such a community event. And then just, if there's grants, I would help find them.
Got
So
it.
that's all I know.
All right.
But
I know there
clearly,
is a fee
I don't think
because
he
you
has
have
any.
to.
Go ahead, Sarah.
Oh, I was just gonna say, I know there is a fee because you do have to purchase the book
Uh-huh.
and you do have to, it's a practical and either online or paper format
Mhm.
kind of test to become certified. So, I guess I would say if people are really anxious to do it in real time and are willing to pay the $65, then he can post it.
Mhm.
If you guys agree with that. Otherwise, the only other option I think would be to wait until the public health nurse or maybe someone else on the fire department has the capabilities, because the issue is you have to be you have to be able to train the public. It's not just because I have my CPR certification, I can't train people. It's a different
Right.
certification. So that, yeah.
I get it. Yeah.
Yeah. But there is interest. I've had phone calls, I've had emails.
Mhm. Okay. And so you are planning to get certified to train the public? Did I
Yeah,
understand
it's
that right?
definitely one of my goals and in the queue. And I've been, like I said, kind of actively working on ways to do it. It's a little bit tricky because we're not affiliated with a hospital. So there's some issues with that. I don't know really all the logistics, but that's what I've been told.
If you want me to put you in touch with the trainers at the jail, we have 3 of them. They run classes pretty much weekly. So they train a ton of people in CPR. And I
So
don't know.
they train to train?
No, they do not. So but they, I'm sure, are very knowledgeable about how to go about that. The trainers
Yeah.
of trainees. So
I know.
So
uh,
so Wim, let me make sure I understand. They don't train to train, but they could train the public. Is
yes,
that correct? All right.
correct. They have the certification. There are 3 of them now.
Mhm.
So it's mostly in-house. They do it for law enforcement. They run classes weekly. So they're really in the loop. If you want me to ask them, I'm more than happy to. Because they
Yeah, let's get as many minds on this as we can. If you would talk to them and tell them what's going on.
all right,
I'll forward the email to you from this Isaac.
all right.
And I'll tell Isaac that we're looking into it and there's possibilities, and he'll just have to be patient.
Cool.
Okay?
Yep.
So Sarah, why don't you tell us about what they're doing in Leverett with their opioid money?
Sure. So, we have purchased a large needle box that was kind of out of that was more the police and fire. And that's
Mhm.
placed at the safety complex. And then they've also purchased several, I think 3 Narcan boxes that go above the AEDs that are at the town hall, the safety complex. And there's one other place, but I can't think of where it is right now. I know the school didn't want one. So, and then obviously in those Narcan boxes goes Narcan. I think it fits 3 boxes, and fentanyl strips or strips like that if you want. And we chose 3 different places so the community could have access during various times.
Mhm.
And then the police are going to send 1 officer to DARE training. There's still the DARE program, and you can still become trained to teach that course in New Hampshire. So
Mhm.
we approved to have 1 officer go there, and then he or she or they will come back and teach that DARE program to the elementary schools, because right now there's really no elementary focused anti-substance abuse program. I mean, DARE was the only one, and there's been controversy about how effective it was, but I imagine that it's evidence-based and somewhat up to date to include the epidemic, but I don't know. And then I am creating, and I think I sent you guys the community assessment survey. Were you able to look at that?
I
So
don't think
basically, it's just a
so.
general survey to get an idea of community needs and wants and their ideas about what they would see to be most impactful with the monies. And then to kind of get an idea of what was helpful for them. So if we could sponsor someone during their treatment and recovery program, that would be an option. Those are all things that would come out of the survey results. So I'm still editing that. There were a couple questions that they wanted to add. And so that'll probably go out, I would imagine at this point, probably the first of the year.
Okay.
And then we'll start analyzing that data and see what folks are interested in or what the needs are, and then come up with another set of solutions after that. We're not really buying into any of the larger grants that, Greenfield and other municipalities have brought to the table, just because we don't have the transportation they're just more focused for a bigger, they're not really, I don't think they're quite individualized for like Leverett and Shutesbury. I think they're more focused to a larger population that's more accessible in real time, if that makes sense. But you guys can look into those grants if you want. There are several out there that you can buy into, and basically they take a portion of your funds and they they don't really offer anything to the rural areas though. Like there's no transportation to pick up people to bring them to these programs that they're offering. So that could theoretically be a problem for someone who is.
Well, obviously.
So there are some barriers there, and Leverett
We would
chose
have
not
to
to
do
buy.
this community assessment first, right? I mean, we wouldn't just assume that there are all these substance abusers in Shutesbury.
Right, but right. But you have the monies regardless. So
Right.
and it's based on prescription buy-in and some other data. So they kind of have an idea of how many people either have or currently in the past or whatever have had issues with. So and that's just one option. You don't have to buy into those bigger grants.
Right.
And then I am interested in hosting, which I think I emailed you guys about, Jarrett, the Hey Kiddo author. He's a graphic novel author, and he published a book called Hey Kiddo, and it's about his journey with a mother who had unfortunately was addicted to heroin. And so he goes around, he's from Worcester, and he goes around and he talks to middle schoolers. So it's kind of an older demographic than elementary school. And he presents, you know, a lived experience of what it was like to live through this trauma and become successful and what that was like. And it's very impactful. I've watched some of his videos, and I think it would be a good way to capture our 7th and 8th graders and our 9th graders that go into the bigger schools. So that's kind of my push. He's expensive. We've already been approved through Leverett. But if you wanted to, you know, contribute, we could, Leverett said that they would be open to that contribution, if that makes sense. Cause he's around $3,000 for, I think, 2 or 3 book talks. And those would really have to be at the middle school or high school because of the population that he focuses in on. It's not for elementary school children. So I haven't really gotten that much further with that. It's been approved through Leverett, and I know Greenfield is looking into it. If not, gonna host him. But Amherst Regional has been not responsive, if that makes sense. I was in communication with the nurses there, and they were like, yes, let's do this. We need this. We have lots of issues coming up right now. This is a vulnerable time for them, X, Y, and Z. There's no other program. And then I haven't heard from the administration, and I've sent 3 emails. So we'll see. I'm hopeful that they'll, I mean, they don't have to, you know, they came up and said, no, we don't have any monies to support this. So then I came back and said, no, we'll cover the cost. It's just, we just need the space and access to the children. So I'm hopeful that they'll agree to it. Cause I think it would be a good start to kind of get this ball in motion. Cause there's really no, evidence-based developed anti-substance abuse programs out there that they're in the works, they're being developed now, but you know, you kind of need to decide or spend some of the monies.
Right. Right, that seems like as good a use for some of that money as any. Perhaps it might be good to make an appointment to go in and talk to somebody in the administration since they're not answering your emails.
Yes, they have said that the people that I have been in contact with said that they would set up a meeting, but it's been pretty quiet. So I will definitely I will get more aggressive with that. See if there's a way to get around the school nurses and more
directly to the
administration. I did send them a letter initially before I got in contact with the school nurses, presenting this information and the fact that we had this opioid settlement money, and I heard nothing. So I'll just keep trying. I mean, because I think it's worth it, to be honest with you.
Okay.
And that's really it. That's kind of where we are. It's kind of all in the works.
Okay.
I know
Sarah, just one other idea.
How about survey, but I don't know what their results were.
Sir, should we be talking to Pelham too? That's the other small town that might have some opium money. I know they're not in our collaborative, but it might be worth touching base with.
Yeah, I feel like everybody's welcome. We all have children that feed into the Amherst school system. And so, you know, I'm happy to collaborate with anybody who would be in support.
I'm just thinking if 3 of the 4 towns are saying this would be a good thing for our children, maybe it would get the attention of the administrators who are busy with a million things, I'm sure. But that was my thought.
If Pelham was on board too.
Yeah.
Yeah.
Because that would be all the schools, the small schools that feed into Amherst Regional.
And Pelham has a public health nurse, right? I don't know who she is, but
that's a good
Wendell
question.
Does too?
I don't know. They're a whole different.
Yeah. I know, it's hard because they're totally not in collaboration, so I don't
Right.
see them, I don't hear from them, really, unless there's like a infectious disease issue. But that's usually Amherst. I don't even know if I've ever spoken to someone from Wendell or Pelham. I think that's
Pelham.
usually Amherst.
Anyway, I mean, it was just a thought. I'm not saying you should or shouldn't do it, but if three of the towns were, interested in contacting the administrators, maybe you get their attention a little bit more too.
So Pelham is part of what's called the Quabbin Health District.
Mhm.
Yeah.
So that crosses county lines. It includes Pelham as well as Belchertown and Ware. I think those are in a different county than we are. What, right, because that's Hampshire County, but so is Amherst. Anyway, so their public health nurse is named Kirsten Krieger, Krieger, and her email is kkrieger@townofware.com. So it's a health
I
department.
actually know her. I didn't realize she
Okay.
covered Pelham, so.
Yeah,
I can-
Pelham, Belchertown, and Ware. Okay.
Okay. Okay. So that's, honestly, that's all I have to report,
Mhm.
unfortunately. It's not like any big ticket items,
Right.
but.
I have just found your survey and I've sent the link out to everybody.
Okay.
With the reminder to not take the survey, just look at it.
Yeah, I couldn't share it in like an edit form, so.
Okay.
What
Got
would
it.
be most helpful, Sarah, from us to move some of these things along for Shutesbury?
I mean, whatever I do for Leverett, I feel like I automatically do for Shutesbury. So if I finalize this survey and I get it out, my goal is January for Leverett. Let's do the same if you guys approve for Shutesbury, and we can try to get it out either on, I'll have a paper copy for folks who aren't digitally savvy, and then we will also get it out via do you guys do the pagers, like the phone blast? I don't know what they're called, but
Yes.
the red
Code Red.
code
We-
red, do you do that?
We don't have access to it that I know of, but the town does use it, and so it could be.
Yeah, so we could try to figure out a way besides posting it on the normal, like the link on the normal, we could try to promote it more. And then are you including the police or the fire in any opioid settlement conversations?
Yes, I had a discussion with Christian about it.
Yeah.
Maybe 3 weeks ago.
So she has ideas, or is she doing kind of similarly to what Leverett's done?
Trying to think what her ideas were now. I reported to the board on it a while ago. Let me look in my notes.
The only thing I remember you're saying, Maureen, is that she hands out a lot of Narcan.
Yes. And there was another program that they used that she thought was kind of effective. Go ahead and talk about something else, and I'll see if I can find my notes from my meeting with her.
Talk quietly among yourselves.
So yeah, that might be an option where you just start by doing the Narcan boxes at different locations.
Right.
Just to kind of host or hold some Narcan. I mean, I have Narcan, she has Narcan, they have Narcan, but sometimes it's just another point of access, basically. But yeah, I mean, it's hard because there's no itinerary of what everyone's spending or should spend their money on. It's like, here's the money and go do with what you want. So we're trying, like, for example, the Hey Kiddo, we had to like look through the language of what could theoretically be approved before they would say, yes, this technically is covered, because it's a little challenging to, and I think it's harder, honestly, for rural towns because we don't have all the access to what some of the other grants are offering, like these program rich offers, you know, how are we going to get people there? I mean, we did just get a PVTA line, but you know, and they actually, depending on which one you choose, you give them $15,000 or something like that, and it kind of captures your demographic or whatever. But I don't know if they're specific or individualized enough for a rural town like Leverett and Shutesbury.
Well, let's start
If
with,
we get the survey back and we find out that there's a family that lost someone from, you know, substance abuse, then maybe we could think about individually sponsoring them in some way or some capacity. Same with if we have somebody who is currently in treatment, maybe we could, you know, sponsor them by paying for their treatment or recovery costs, or, you know, getting their license back. I mean, there's a lot of options, I think, once we get some information.
Mm-hmm.
right.
Can I speak to that a little bit? I think that's kind of a slippery slope, Sarah, because that can be really expensive. And, you know, if you start with one family, then what do you do if you have 2 or 3 others and you don't have enough funding to cover that kind of thing? So,
Well, I was thinking about that, and I was thinking maybe if we offered like a kind of like a grant option or some kind of like application process where, you know, we have this amount of money, we could sponsor you for X, Y, and Z. If you're interested, please apply. And then we would have the, you know, the ability to pick and choose whatever based on whatever we would be, whatever the considerations would be. But I hear you, you're right.
Yeah.
Like people would probably demand, but a way to get around that would be this kind of like application process.
Mm-hmm.
Which
right,
we
and
could,
maybe a limited, maybe we designate, I don't know, $2,000
yeah, we
a year
sponsor
for
2
that,
people
for
a
that
year
one
or
person.
something like
Yeah.
that. Yeah,
Yeah,
yeah.
okay, that makes
Or one
sense.
person a year.
Yeah,
And
right.
this is the criteria, and you have to show evidence of, you know, the fact that you were incarcerated or you've been whatever. Like,
Yeah.
yeah, we could do some, like, I think we have a lot of opportunity. We just need to figure out what the need is.
Right.
Sarah, did you say early on in your presentation here that are you using the PMP to identify potential substance users, or did I misunderstand that?
The community assessment survey?
Yeah, I thought I might have misheard, but I thought you said the prescription monitoring program. Are you?
Oh, that's I think what some of the monies were based on. However many scripts of buprenorphine were were prescribed to folks who had a Leverett or Shutesbury residency, that was included in the settlement funds. So if you had so many people with a prescription, your funds were higher from what I've understood, plus other factors. But yes, it's based on prescription. And
Yeah,
I think overdose deaths, which I don't think we had that many. We had like 1 or 2, but that would be another demographic that was included in our.
Yeah, that makes
But
sense.
my assessment is very broad. It's very much like it's anonymous, and it's just like, what helped you in your recovery? Were you ever addicted to X, Y, and Z? Did you have trouble with whatever? What was most effective? What didn't work? I don't know. It's kind
Right.
of
Thanks
just
for
an idea.
clarifying.
I have one other question about that, Sarah, and to the rest of the board. if this is going to be a survey that might go out on some sort of town-sponsored blast, do we need to run it by the select board or anyone else, Board of Health?
I think it would be smart to do that.
That's what I'm thinking. Just to give them a heads up.
Mhm.
Right, and also I would think that we would want to also just alert the police chief and fire chief that we're doing it. I don't think we have to ask permission, but I think
No.
it's a good idea to have the other administrators, involved or aware of what's going on.
Yeah, from my conversation with both of them, I'm certain that they'll be supportive, but I think, yes, we need to have everyone informed so that they're not surprised when this, announcement goes out.
Right, the
And-
tricky thing in Shutesbury is going to be getting the surveys out there where people can see them and take them.
Yeah.
Because that has historically been very difficult.
Mhm.
We could consider mailing them out. That's pretty expensive, but we could think about it.
I was just gonna say, and if any stakeholder like police and fire want to edit or contribute to the survey, we can collaborate. It's not, I don't own it, like it's just
Right.
something I created, but it's really, if you have a better way of asking, or if you know the demographic more intimately than I do, then let's, the police might have a question that they have been thinking about that they want to put on there, that may be worth asking. So yeah,
I'm
open to
assuming that we'll
as
want
well.
to edit it to some extent.
Yeah, I'd be very interested in seeing it.
I have just sent a link around. So we can be thinking about it and having suggestions, and obviously nothing's going to happen before the first of the year, so we can take some time to just look at it and think about it.
And some of the questions, I think there's like 2 questions. Deerfield sent out a very basic check all that apply survey. And so some of that language is the same in 1 or 2 of the questions. So it's just been built up depending on what different towns have used.
Good. I think it's a great start.
Mm-hmm. I agree.
Do we have anything else to ask Sarah?
I do not.
Yeah, I think that seems to me to pretty well cover the waterfront there. Thank you, Sarah.
Yeah.
You're welcome.
We'll certainly be back in touch.
I think the
Yeah,
one
let me
other
know.
thing that might be to let us know how much the program costs, the middle school program. Sarah, what would be a helpful amount of money to provide to that program? Or you
Yeah,
said
I
the
think
whole
that's
thing
up
is
to you because-
$3,000. So
Right, Leverett already agreed to pay for it. So I think if you want to
Okay.
contribute, that would be a discussion based on how much you would want. Like, we're not asking if you want to pay for half, if you want to give $500, whatever. I think it was open to, it would be helpful, but if not, then I think it's still approved. So that would be up to you.
We could sponsor more sessions of it down the road if it's successful, would be another way to do it.
Right. Yeah, yeah.
You might want to do one in the fall and in the spring, or
See
something.
how it goes,
Yeah.
right?
Yeah.
Okay, well, if we don't have anything more to say on that at this point, Sarah, you're welcome to stay in the meeting, but you probably have other things you want to do.
I'm gonna head out, but I appreciate you inviting me, and I'm glad that we could talk about it. And I look forward to hearing what you guys have to say about the survey and anything else that comes up.
Okay,
Thanks.
And I'll let you know
Thank-
about the CPR.
Yeah.
Great.
Okay, great.
Thank you.
Thank
Okay,
you, Sarah.
Sarah.
Thanks for coming, Sarah.
Bye.
Bye. I have to say, I can't imagine there's a huge population of Shutesbury people with substance abuse issues, but maybe I'm wrong.
I think it's often invisible.
I
Well,
was
there's-
just gonna say the same thing. I think it's often flies under the radar and we don't know, Kat.
Right, and of course, there's also, I mean, this middle school thing that she's talking about is a preventive measure, and that's
Mhm.
always
Yeah.
worthwhile.
Right?
As it relates to the funds, I think it would be helpful for us to regroup with the interim town administrator.
Yes.
Because in Becky's transition, so the account is established, but my understanding is that the funds are not in the account as of yet.
Okay.
And why is
Um,
that?
I think it's because the account was established, but the funds, there was never the request made for the funds.
Sorry.
And Becky closing out her time with the town.
Yeah,
I don't know if that was completed.
okay,
Okay.
okay, well, if you could follow up on that, you're the one who knows what's going on there. Well,
Okay.
I have two of you, is there?
I know, I'm running out of battery on my phone, so
Oh, I see.
I tried to,
Well, I admitted the second one of you, so,
thank you. I'm turning off the first one of me.
okay.
Yeah, so I'll send an email and just ask to schedule time to remind me of the interim.
Gabe,
Say,
Gabrielle Volker.
oh, Gabriel.
She used to be our town, our treasurer.
Okay,
Oh, I didn't know that.
Yeah, way back in the day. She was the treasurer for the district as well.
Okay.
Hmm.
Yeah, she's
Like we're
only in 2
lucky.
days a week, but
Mm-hmm.
did somebody, was that you, Noreen?
Yeah, I just said it sounds like we're lucky to have her. We're fortunate to have her as interim.
Yes.
Yeah, yeah, but it's only gonna be until, I think, something like 12 to 14 weeks, so, the whole thing is weird. But there we go. I just wanted to tell you that we got an email from, some one of these agencies of, DPH asking about the potential impact of drought on people's drinking water wells. And they asked if we, it was a very brief survey, like, how many instances have you heard of loss of water quality or water quantity because of the drought? And I said, well, none. Nobody has complained to me about losing their water. And in fact, last night at special town meeting, Bob Grove stopped me to talk about well, because he said he was thinking about drilling a well, even though the well he has, which is a 12-foot dug well, has excellent water, and he didn't have any loss of water quantity during the drought. So I said we wouldn't stop him from drilling a well, of course, but I wouldn't do it if it were me. Because really, if that well didn't go dry this summer, I don't know when it would. But I don't know if anybody else has heard anything about anybody having a well problem.
No.
I have not. I was wondering about that recently. But
Yeah,
have-
I've been amazed that
Yeah.
no, there haven't been any well permit applications for people whose wells have gone.
Maybe we should contact our friend Dr. Werner and see how his test wells are going.
Oh, that's a good
Update from
idea.
him.
That's a good idea.
He's still
Yeah.
monitoring those?
I don't know,
I'm
but
not sure.
I would think so. So his students were, I think it was his student project.
Mm-hmm.
Maybe so. I'll send him an email and see if he has any wise words about it.
Yeah.
Is there anything else we need to think about or talk about or do?
No update on 56 Wendell Road?
Oh, shoot, I meant to ask for one. No, I don't have an update.
Mm-hmm.
All right. And do we have a collaborative meeting coming up, Garrett?
I'm not sure.
I haven't gotten any notices of
I
any,
haven't,
so, but
I haven't
we
seen
have to,
anything recently.
yeah, there must be one coming up this month, I would think.
If so, it's next week.
Okay.
Hmm.
I would think it's next week.
A week, yeah, next Thursday.
Yeah,
Yeah, okay.
but I don't have anything in my calendar currently.
I don't either. I don't think we've gotten a notice.
Oh, that makes me think that I should just report on what happened with Claudia and Megan. Claudia has a hand injury and she had to go on a sort of reduced schedule. So she was asking for somebody to witness some perk tests for her in Shutesbury. And it ended up that Megan did them, and apparently Megan has recently taken a soil evaluator training, and so she went out on these things. And it didn't go well. Let me
Uh-oh.
put it that way. She told them, I mean, here she's been trained for like 2 minutes, and she's telling people who've been doing this for decades that they're doing it wrong and they're supposed to be doing these other things. And apparently she herself actually went down in one of the holes, which is about the most dangerous thing you can do
What?
to examine the soil layers and stuff.
Oh, dear.
And the one of the guys was Alan Weiss, who's only been doing this for 40 years, and in whom I have total confidence, and so does Claudia. And Alan and whoever the other guy was, like I can't remember his name, somebody we don't see very often. They went and they complained to Charlie about this, and so Charlie passed it on to Claudia. And by the time I talked with Claudia, she had already had a conversation with Megan and impressed upon her that safety was the primary consideration, and that you should never go into a hole that's higher than chest height and all that. And also tried to impress upon her that what you learn in these classes is kind of theoretical and everything is sort of perfect, but out in the wild, things work a little bit differently. And I suggested that maybe when Claudia is going out witnessing perk tests, that perhaps Megan could go with her and kind of see how it's done. I asked Claudia if feathers were still ruffled, and she said with the guys doing the perk tests, and she said she thought they were pretty well smoothed down.
Good.
So I don't know if now there's a guy that's been hired by the collaborative. His name is Mike. I don't know his last name, and who's soon going to be certified for Title V related things. And I hope that we're not going to have the same kind of problem with that.
My sense of Megan is she'll learn pretty quickly from this and probably share that information with Mike as well. And that's my sense of her, Kat, that she's not all full of herself or anything like that.
I pretty much made the same observation to Claudia.
Yeah.
She's not somebody to let her ego get in the way. That's my
No.
my impression. So I imagine it'll work out, but
Mhm.
it was kind of a little bump in the road there.
Yeah.
Yeah.
I don't think I have anything else that needs to be talked about. Does anybody else have anything they want to say?
I usually like to move for adjournment, so I will
Yeah.
do so.
Second.
All right, all in favor?
Yes.
Yes.
Yes, yes, yes.
Unanimous.
All right. So I'm going to stop the recording here and